Dehydration is the biggest enemy of pregnancy, and there is no doubt about that. Dehydration often causes serious complications such as inhibiting the development of the baby, preterm labor, and lesser production of breast milk. But despite these scary results, there is good news. You can prevent as well as gain lots of benefits by drinking sufficient amounts of water during pregnancy. Water plays a major character in the maternal period that welcomes great results. These results typically include formation of amniotic fluid and placenta, transportation of essential nutrients to the baby, and prevention of pregnancy-related issues. Importance of water during pregnancy. Water is as important as any other prenatal vitamins to a pregnant woman. Moreover, water is what helps your body to absorb essential vitamins, minerals, hormones, nutrients, and foods that consequently assist the baby's development. It is even one of the most important elements of amniotic fluid. Amniotic fluid further assists the baby to move in the uterus, allowing proper bone growth of it. Along with that, it helps in the formation of placenta as well. But that's not all. Water also puts pregnancy in healthy motion by building new tissues and of the fetus. It carries nutrients that are crucial for the infant. Water, on the other hand, aids unusual pregnancy symptoms. For example, fights off indigestion, constipation, heartburn, fatigue, and a lot more. Benefits of drinking water during pregnancy. Intake of the required amount of water is crucial for pregnancy more than anything else. Expectant women are thoroughly advised to drink 8 to 12 cups or 64 to 96 ounces of water per day. That invites lots of advantages. Why the consumption of water is so important for pregnant ladies. These advantages of consuming water in pregnancy are discussed below on an individual basis. 1. Relieve constipation. Constipation is one of the weird early pregnancy symptoms that pregnant women run into. And it may even last throughout the pregnancy. Constipation usually occurs for hormonal changes, especially for progesterone. This particular hormone relaxes your intestine or bowel, making it less efficient to squeeze the stool out of the body. Ergo, results in constipation during pregnancy. However, staying well hydrated possibly leads to your chances to feel constipated, since it softens your waist. Plus, it even makes your stool heavy, which is quite easy to pass. 2. Controls overheating. Overheating during pregnancy is a matter of concern as it can lead to adverse results. It has been observed that women who get overheated in gestational period are more likely to get dehydrated. Dehydration is a risk factor that can cause heat stroke and heat exhaustion. It can even affect the fetal growth and lead to cleft palate of the baby. But fortunately, there are several ways to reduce overheating. And one of these ways is drinking enough water. Staying hydrated keeps overheating at bay by cooling the body both internally and naturally. 3. Keep urinary tract infection under control. Drinking enough water ensures the reduced chances of experiencing urinary tract infection or UTI in pregnancy. Besides, UTI is a common pregnancy infection. It is common among expectant ladies because in pregnancy the pee tends to hold a higher level of protein and sugar than usual. Plus, the increased levels of hormones to blame as well. But, having enough water during pregnancy dilutes your urine and lets you urinate frequently. This factor further flushes out bad bacteria from the urinary tract before the infections could initiate. 4. Eases high blood pressure. One of the helps that staying well hydrated can provide you is the lesser chances of high blood pressure while gestating. An unmanaged hypertension is fatal for motherhood as it can result with unfriendly outcomes including preeclampsia, preterm birth, C-section, childbirth, placental abruption, so it needs to be managed somehow or other. Nevertheless, keeping your water levels on track can easily prevent gestational hypertension. Water can flush out the excess amount of sodium, the leading cause behind high BP. It also helps to maintain a healthy blood flow. Other than just drinking water, you should also practice exercise, limit salt intake, avoid smoking and drinking to lower your blood pressure. 5. Can promote healthy weight. A healthy weight is crucially needed to have shortened and less complicated labor. However, Being overweight during pregnancy on the flip side can cause gestational diabetes, major birth defects, gestational hypertension, and in worse stillbirth. But drinking enough water in pregnancy sharply reduces the possibility of obesity. Not to mention its good qualities, water is 100% calorie-free, burns toxic fats and can suppress unwanted eating that typically occurs for pregnancy food cravings. All of the mentioned factors dramatically promote healthy weight in pregnancy. 6. Can aid headaches. Those frequent headaches are really annoying to tolerate. Still, there is something that could probably help you out. And that's again, water. Typically, headaches in the maternal period crop up because of dramatic hormonal changes. Along with this factor, the higher blood volume in your body can often contribute to headaches. But multiple studies have observed that being rehydrated can relieve headaches. 7. Fight off pregnancy cramps. Cramping during pregnancy typically occurs because of the growing uterus. Your womb expands gradually to accommodate the growing baby. But this process can result in mild to severe cramps. In addition, getting yourself dehydrated can even be a cause behind cramping, since lack of water makes your muscles seize up. But drinking enough water fends off cramps. 8. Shun out fatigue. Fatigue or feeling extremely tired is another weird pregnancy sign. As you would guess, being fatigued again occurs as a result of rapid hormonal changes. But apart from hormones, fatigue can come about for dehydration as it impacts the flow of oxygen to the brain. 9. Dizziness. Feeling dizzy all day long is definitely not a thing to carry on with. Moreover, dizziness during pregnancy is the obvious result of increased hormonal levels and of course being dehydrated during pregnancy. Referring to dehydration, it forces your blood pressure to face a dramatic drop. This abnormal bodily factor can consequently lead to lesser oxygen flow to your brain, thus resulting in dizziness. But you are properly hydrated, you create a lesser risk to experience low BP, which wards off dizziness in further. 10. Can aid bloating. One of the major outcomes of drinking enough water during pregnancy is minimizing the effects associated with bloating. As about bloating, it is fairly common in pregnancy. It typically comes about for vast changes in your digestive tract accompanied by the surge of hormones. Water, however, can help to reduce bloating by riding the body's excess sodium levels. 11. Prevent indigestion. Pregnancy can cause havoc on your digestion process as your baby continuously and vigorously presses on your stomach. And hormones are equally blamed. These two factors, in combination, can lead to indigestion. But who cares that, as water is again at your rescue. Drinking more water can help break down the food you eat in a limited period. It can also help your body to absorb nutrients in your food more frequently. This help put down by water can significantly aid indigestion in pregnancy. 12. Aid water retention. Water retention is fairly common in pregnant women since about 80% of women report experiencing it. Although this common thing isn't harmful, it can be extremely painful to tolerate. When your body lacks water, it puts maximum effort to hold on to extra water. So, this is what causes water retention during pregnancy. But, as unexpected as it may sound, drinking enough water literally helps keep water retention at bay, as it won't let your body hold onto extra fluid. Thus, hydration provides a limited opportunity of facing water retention in pregnancy. 13. Increases energy. Facing a lack of energy these days? No worries, because water is here for help. Water has been observed to keep energy levels up by keeping your muscles energized. Moreover, getting dehydrated, on the other hand, can manifest with a lack of energy. So, keeping your water levels up means keeping your energy levels up higher. 14. Aid hemorrhoids. Water is a blessing to those who suffer through hemorrhoids in pregnancy. In case you don't know what hemorrhoids are, they are swollen veins in the rectum, opening in your bottom. They can cause itching, burning, bleeding, and are in fact common in pregnancy, especially in the last trimester. However, keeping your water levels in check can keep the chances of hemorrhoids at bay. This happens because water as well as other fluids can assist the fiber in your diet work better. This can help regulate bowel movements that can treat and prevent hemorrhoids. 15. Softens skin. Who does not want a soft skin? There are various ways you can undertake to make your skin softer and healthier. And these measures typically include hydration as the utmost consideration. For most women, pregnancy might not be the thing that helps skin to glow. As an alternative, it often results with acne, dark spots, and stretch marks that are least charming. But staying well hydrated can help your skin to get better. This can take place because water magnifies your skin's elasticity, moreover, softens it. 16. Relieve swelling. Swelling is notably common in pregnancy, particularly in your legs, ankles and feet. It often gets worse in the days prior to delivery. Other than pregnancy-related issues, improper hydration can also be a factor that leads to swelling in pregnancy. This happens because your body may hold the fluids it does not have. Thus, proper hydration is mandatory. Intake of the proper amount of water can keep swelling at bay. 17. Progresses pregnancy. Last but not the least, water is crucially important to progress your pregnancy according to the plan. It is necessary for supplying in-demand blood flow to your baby. It also helps in the formation of placenta, amniotic fluid, new tissues, preparation of breast milk, and important organs. That's why water is essential for pregnancy. These above-mentioned benefits rigorously answer how important is water during pregnancy. Let's now have a look on what can possibly happen if your body gets dehydrated anyhow. Dehydration during pregnancy. Dehydration can be a worrisome event in pregnancy. It simply means a serious loss of body fluid caused by various reasons including illness, heavy sweating, inadequate fluid intake, frequent urination, and frequent vomiting in pregnancy. Symptoms of dehydration in pregnancy. The following ones are the signs of dehydration while pregnant. Decreased need to urinate, dizziness, sleepiness, feeling fatigued, dry and sticky mouth, feeling thirsty, headache, constipation. These are the indicators that indicate the fluid level in your body is running out and you have to refill that as soon as possible. Effects of dehydration in pregnancy. Dehydration is a matter to take seriously by pregnant women. Although mild dehydration isn't a matter of concern, severe dehydration can be damaging for pregnancy. For example, it can certainly cause lower levels of amniotic fluid, preterm delivery or prelabor, improper development of infant, lower production of breast milk. That's why water intake should be in check. But the problem is, there are various factors in pregnancy that can lead to dehydration. These factors, in addition, are briefly discussed below. Thus, check them out. Why water level decreases during pregnancy? For a number of reasons, pregnancy can lead to dehydration. For instance, these are the contributors of lower levels of water level in pregnancy. Frequent urination, frequent vomiting, shortness of breath, increased sweating. These are the reasons that make pregnant women more probable for facing dehydration. So, all in all, how can you fight it? What are the best ways to stay up on hydration aiming to reduce the possibilities of fatal consequences in pregnancy? Let's find out. How to stay hydrated during pregnancy. From the above analysis, it's clear-cut that water is more than just a need for pregnancy. So, in case you're not drinking it in enough quantity, here are some tips for drinking more water during pregnancy you should probably be implementing and loving as well. Make hydration a daily habit. 1. Keep a fancy water bottle handy. 2. Keep a cup in the restroom. 3. Avoid what that dehydrate you. There are some foods that won't help you with anything but dehydration in pregnancy. For example, here is a list of foods and drinks that require sufficient water intake in return, unless you will soon be dehydrated. Sugary treats, caffeine, alcohol, salty snacks, fried foods, ready meats, soy products, blueberries. So, whenever you're about to snack on these foods and drinks, make it a topmost priority to stay well hydrated. 4. Have more fruits and vegetables. To today's date, everybody, even my neighbor's cat, knows that fruits and vegetables hold the maximum amount of water indeed. That's why, ensure delivering water-rich vegetables and fruits to steer clear of dehydration. Hydrating foods are, the following ones are the water-rich foods that you can ever get: bell peppers, broccoli, oranges, strawberries, watermelon, cucumbers, tomatoes, apples. Including these above-mentioned foods, having the highest percentage of water in your pregnancy diet will benefit your health. 5. Give a shot to flavored water. Don't feel that drinking water for the sake of hydration is quite boring sometimes? If you feel so, then give a shot to flavorful water instead. For example, you can add fruits like lemons, limes, frozen raspberries, cucumber in the weather, aiming to enhance the taste. In this corresponding way, you will be more motivated to drink water. 6. Don't wait until you feel thirsty. 7. Add other sources of fluids. 8. Drink more water when you are busy. 9. Reward yourself. Rewards are the resource to a healthy habit. And sometimes they are the motivators. So, set a goal to drink certain amounts of water per day and then reward yourself. For example, you can reward yourself with a tasty snack, an occasional soda, milk, or juices at the end of the week. Undertake this habit and observe its benefits. It will pay off. So, this is what you can do to stay well hydrated during pregnancy. Let's go to the next topic. And it is 4 signs that your body is well hydrated. Similar to dehydration, proper hydration also bears some signs. Moreover, you can automatically feel the feeling of proper hydration. Referring to the signs, the proper hydration includes yellow to bright color urine. The stream is forceful. No sign of dry skin. Not feeling thirsty. Healthy drinks to try for fluid intake in pregnancy. There are several drinks to try rather than water only, but water is the best among all. They can benefit you and rigorously help in maintaining a proper balance of fluid levels in your body. They are as follows: safe smoothies, coconut water, lemonade, fruit juices, iced tea, vegetable juice, pasteurized milk and milk-based products. Apart from only maintaining a sound fluid level in your body, these drinks can provide you with a variety of beneficial elements. So, infusing these drinks in your daily routine is something more than just a good idea. How to stay hydrated during morning sickness. Morning sickness is one of the cruelest early pregnancy symptoms that can cause nausea and vomiting. Food aversion can be one of the consequences of morning sickness though. As for vomiting, frequent puking can result in less fluid and electrolytes in your body, clearing the way of dehydration. So, you can follow these tips to stay well hydrated during morning sickness too. Avoid the fluids that trigger the symptoms of morning sickness. Keep water bottle by the bedside. Drink small amounts of water throughout the day. Aim to drink at least 2 liters of fluid per day. Intake the safe substitutes of water in case drinking water during pregnancy makes you vomit. Have oral rehydration solutions in order to refill the lost electrolytes in vomiting after prescribed by doctor. This is how you can stay hydrated while vomiting during pregnancy. Morning sickness can be very serious, causing extreme vomiting with nausea. This condition is called hyperemesis gravidarum. In this condition the above-mentioned tips may not work. So, consult with your doctor or healthcare provider if you are facing this unusual issue. They will help you in every way possible. Effects of drinking too much water during pregnancy. Drinking too much water is pretty much an impossible thing when you have a tiny bladder and have the symptoms of morning sickness. However, drinking too much water during pregnancy can lead to water intoxication. In this condition, your body takes water in faster than it can filter this amount out. But for that, drinking water more than required will let you have more and frequent bathroom trips. Signs of water intoxication in pregnancy. Oftentimes, the symptoms of water intoxication result in edema of the CNS. But in more, it can also cause feeling fatigue, reduced consciousness, headache, nausea, abnormality when walking, muscle weakness, dizziness, excess urination, sleepiness. In severe as well as in rare case, the symptoms of this condition can cause confusion, coma, seizures, excess vomiting. For this concern, Pregarlybody highly recommended you to use pregnancy water intake calculator to not to undertake or overtake water in pregnancy. How much water should a pregnant woman drink? Water has too many benefits on pregnancy and is crucially important. A pregnant woman should drink 8 to 12 cups or 64 to 96 ounces of water per day. Last words from Pregarlybody. I genuinely hope that you got a lot out of this article because there is a lot to know here. Since you are expecting, expect to devote at least a year for the welfare of your baby. Because what activities you undertake will firmly decide your baby's future. So, get a little active now. Do some exercises that you have never done before. Forbid some delicious yet dangerous foods for your baby. Add something valuable to eat. Be a little more hygienic and especially stay very well hydrated. All these things will pay you off. Besides, I hope that you came to know a thing or two more new things about the benefits of water during pregnancy. All at the